We're really privileged this year because representing the international perspective, we're joined by a very distinguished guest. It's Professor Dr. David Kerr. Dr. Kerr is the president of ESMO, the European Society for Medical Oncology. He is also health advisor to the British government and many other things. The first one is international patient advocacy, perspectives and issues. How do we enhance the way we work together across continents, and some of the needs that you feel need to be identified for more successful collaboration?
What I think I'd like to do is to try and explore the concept of collaboration, collectivism, and the power of partnership. So I've been a cancer physician for 30 years, and everything that we say that we put the patient at the heart of all that we do. But some years ago in ESMO, my society, we were making these claims, but we noticed there was a complete absence of patients, advocates, any sort of sense of support at all at our meeting. We've changed that. So we now have a very important track all the way through our meetings, and an opportunity through seminars and through other different vehicles where patients, carers, professionals can come together to see what we can do to develop and strengthen the idea of cancer health policy. I think what I'd really like to talk about, though, is the internationalism of this. At this great meeting, more than half the physician attendees here are coming from outside the United States. And it seems to me that we're actually in quite a small global village in terms of the cancer community. And although the cancer journey is intensely personal and individualistic for each patient, there are many components of it which can be shared, which are generic, which we can learn from each other, not only within the States but internationally. And I think the challenge that I would like to make to you as expert advocates is what we can do together from the rather wealthier nations to see what we can do to help prepare cancer advocates in the developing countries and in the third world. And I say that because by 2020, 70% of all new incident cases of cancer are going to be in developing countries with low incomes. So those countries which are least well prepared to deal with the coming cancer problem are those which are going to bear the greatest burden. And isn't that extraordinary? Don't you assume that cancer is a disease of the wealthy, of the North and of the West? Well, it's not. And it seems to me that the advocacy lessons that you've learned, we need to see how we can translate those to civil society in sub-Saharan Africa, in the poorer countries in the South Americas, in Southeast Asia. And what I would like to see from you is a discussion about how we can transfer the experience, the knowledge, the learning that you've got to see how we can energize and motivate civil society. In sub-Saharan Africa, there are 2,000 dialects and most of them don't have a word for cancer. So how can you name the beast? How can we understand it when it's so hidden and pushed away, still within the province of witch doctoring, herbalism and so on? And it seems to me that you've been so effective, the countries that we've seen represented here, increasingly in Japan, in Europe and the United States. And I'd like to see how you can transfer that knowledge base internationally, because the issues are a lot the same. It's about awareness raising, it's about prevention, it's about access to treatment, it's about trust, it's about end-of-life care and palliation. The journey is the same, whether it's from Accra in Ghana, whether it's in Washington, whether it's in Oxford. There's got to be lots that we can share. And I'd love to harness your experience and see how we can take that back together to those countries which are less well off than us, but no less deserving and no less needful. Do you think it's reasonable? Do you think that, is there a room for altruism in the world of cancer advocacy? Or are you here for yourselves or for your own patient groups? Or can you lift your heads up to a more distant horizon and see what can we do to help?
Yes, I'm Ginny Mason with the Inflammatory Breast Cancer Research Foundation. And I think you're right. We do tend to be very focused on our own disease in our own organizations, but I think many of us represent organizations that do have our main presence on the internet, which does make us a bit more global just in that very fact. My own organization doesn't have a walk-in office because we felt like we deal with population that's more global. And I think there are opportunities if more of us could be involved in the larger cancer community and maybe be a part of international meetings. It gives an opportunity to share whatever we know and what we've done with somebody else.
So fantastic. So let me challenge you further as a group. At the end of September, the United Nations will be holding, for the second time only it's in history, a high-level meeting. This is for presidents and heads of state to discuss chronic diseases, of which it's cancer, diabetes, cardiac disease, and respiratory disorders. And this is us trying to get chronic diseases onto the global health scene, because all the focus is on infectious diseases just now. But we know that from our colleagues in the developing world, we must work with them. Chronic diseases are responsible for 60% of the world's deaths. Now, there is a huge political battle going on, and we would love to get President Obama to come to that meeting. You know, he counts, and 10 minutes of his time is worth, a lifetime of ours, etc., etc. We don't know if he's going to come or not. And I would like you, who are based in America, to see if you could find some way of writing to the White House saying, President Obama, turn up for this meeting. Even if it's a fleeting visit, your presence here will make an enormous difference to other cancer advocates and to start the momentum and the ball rolling around the world to see how we can actually get the UN to make a difference and how the developed nations can help those who are less well off. So I think ASCO leadership, we're all going to sign a letter, the docs doing all that saying, please come, please come. But how do you do it? How do we get, I think you've got a more powerful voice than me. Your collective voice together will carry further in the corridors of powers than the docs, because, the docs. So how do we do that? Can anybody help? Who's going to volunteer to be the person that will draft a letter to Obama from this meeting today here on behalf of the advocates to say, come to this meeting and make a difference? I'm using his terminology now, make a difference. Who's going to help do that? Or is that a crazy idea? Or will you get into trouble? Or am I being sort of too mischievous for you? I'm going to ask somebody at the back to respond. Fantastic.
Kristin Richeimer with the International Association for the Study of Lung Cancer. I'm actually originally from the DC area. I have a good friend who works for a congressman. He's the third ranking congressman in the House of Representatives, so I can see what connections I can do, but I'm also happy to send out information and collect information and work with our group and your groups to put something together.
So advocacy in action. So here we have a volunteer. Here we have someone who's leading. So at the end of the meeting, you're watching time and so on. Why don't we see how we can collect people together and let's get the ball rolling? Because if President Obama comes, it's a whole different deal. It's a whole different deal for all the reasons that we don't need to rehearse here and so on. And I think if we do the pincer movement, there's nothing more powerful, we talked about partnership, than our voices race together. And the docs on their own, easy to sort of sweep aside because we're always up to something and we're a deeply suspicious mob. But I think if we have sort of decent, sort of free-minded advocates like yourself, that's how we make a difference.
I think you raise a really interesting point that I think is applicable. Certainly we've seen it in Western nations, but I think in developing nations also, which is keeping an open dialogue from the patient groups to the government agencies, and whether they're ministries of health or whatever organization sets standards, helps regulate drugs. I think that would be a lesson that is applicable to all countries, that patient advocacy groups, no matter how sophisticated they are, should continue to engage in that level of discussion.
Our focus primarily right now is on patients here in the U.S., but we serve patients in 67 different countries right now. So we truly do have an international focus as well, and definitely recognize the disparity that's out there in terms of different countries and their lack of access to treatment and support and so forth. So I just wanted to offer my help as well, to efforts that are taking place here, and just wanted to emphasize that we as a group definitely have, we attend international meetings with our specialists and really make an effort in this regard, and definitely want to lend my support and our support in this effort as well.
Fantastic. I think we should be asking somebody to make placards. I think we should go on a march. I think we should march somewhere and sort of demonstrate and wave things. We don't do enough of that, do we? I mean, if you look at the only other UN Health Day was around AIDS, and if we look at the AIDS activists, goodness gracious me, haven't they been extraordinarily successful? So why don't we see cancer advocate and patient groups on this? Maybe you do. Are you out there with placards protesting? Are you standing in the streets of the capital? Are you making a noise? Are we being too polite? Shouldn't we be angry and raging and shouting at the dying of the light? Or is that a bit too strange and radical?
Joya Delgado Harris with Why Me National Breast Cancer Organization. And when you first opened your comments, one of the things that struck me was the definition that I had to memorize in grad school in public health, which is public health is what we as a society do collectively to assure the conditions in which people can be healthy. So that society is a global society. It's whatever society you make it. So I absolutely agree with us as a cancer community globally, working together to help others, because cancer transcends race, gender, everything, so we have to, it's the same issues. And what also, it's of paramount importance that we, I believe, learn some cultural competencies and some cultural understandings that we know how to talk with people. That's very complex, but I mean that we talk with people and understand where their cultural norms and what makes them comfortable with being able to help themselves through a disease state.
Let me ask another question. I mean, do you have a natural forum for coming together as advocacy groups? I mean, the notion, I said that and I meant it. The more united voices are, the further they carry in corridors of power. So all your wee tiny groups are wee and squeaky, but you come together and you're a massive choir that sounds loud. So do you do that? Have you got a natural meeting place in which your voice joins as a choir and you influence people? If not, you should get one. It's mad not to.
I would encourage you, since this is an ongoing initiative now, we're taking this on the road. We're doing more and more AIAs, not only in the US, but in Europe. One of the ideas that we've had was to hold some kind of communications, basically a summit, for the advocates from the US and in Europe to sit down at a round table and begin to hash out these issues and try to form some kind of a cohesive entity that we can partner on a global level. One, I want to thank all of you and really this panel, because this could not be done without the expertise of individuals who are extremely well-versed. I hope you have a very successful rest of your ASCO meeting. Thank you very much.
Thank you, Selma.